Welcome back to the Rundown Lab, where we break down and fact-check the biggest health podcasts. We know your time is valuable, but when you can, we always recommend catching the full episode. Links are in the description. Fact: if that brain fog you've been experiencing isn't the beginning of the end, but actually something far more manageable. A recent conversation between Dr. Peter Attia and neuroscientist Dr. Lisa Mosconi explores this question, and the answer might surprise you. In this episode, Dr. Mosconi discusses Alzheimer's prevention strategies specifically for women, covering everything from menopause-related cognitive changes to exercise and lifestyle factors that affect brain health. With 8 major claims to examine, I'm pleased to report this is one of the more scientifically solid health podcasts we've reviewed. 3 claims are fully accurate, 3 are mostly accurate with minor caveats, and just 2 oversimplify more complex relationships. Notably, nothing in this episode was misleading or false. What they got right. Let's start with what this episode nails. First, the reassuring news many women need to hear. Dr. Mosconi explains that cognitive symptoms midlife women often fear are early-onset dementia can frequently be attributed to menopause-related changes instead. This is well-documented science. Studies show 60 to 70% of perimenopausal women report subjective cognitive difficulties, that classic brain fog. Meanwhile, actual early-onset dementia, meaning dementia before age 65, accounts for only about 5 to 10% of all dementia cases. Research confirms these menopause-related cognitive symptoms typically stabilize after menopause and don't progress to dementia. The episode also accurately identifies cardiovascular risk factors, including high blood pressure, insulin resistance, diabetes, and obesity, as modifiable risk factors for Alzheimer's disease. This is strongly supported by the 2020 Lancet Commission on Dementia Prevention, which identified these among 12 modifiable factors accounting for approximately 40% of dementia cases. The mechanistic links through cerebrovascular damage, neuroinflammation, and insulin signaling in the brain are well established. Finally, the discussion of how delaying dementia onset through lifestyle modifications could be clinically meaningful is appropriately framed. Given that dementia risk increases exponentially with age, even modest delays could substantially reduce lifetime dementia prevalence. Where it gets more complicated. Now, a couple of areas where the episode oversimplifies the science. Dr. Mosconi describes an inverted U-shaped curve for exercise intensity, suggesting moderate intensity exercise provides greater health benefits than either low or high intensity. The reality is more nuanced. For many outcomes like cardiovascular health and mortality risk, the relationship is curvilinear, but benefits often continue at higher intensities, just with diminishing returns. Some research actually shows vigorous activity provides additional benefits beyond moderate activity for certain outcomes. A more accurate framing. Moderate intensity exercise provides substantial, accessible benefits for most people, while the optimal intensity varies by individual fitness level, age, and specific health goals. Similarly, the discussion of brain plasticity characterizes the brain as slower to adapt than other body tissues, requiring long-term consistent interventions for lasting changes. This is partially true but oversimplified. Some neural changes, like synaptic plasticity, occur within minutes to hours. It's the structural changes, such as neurogenesis and white matter remodeling, that require sustained stimulation over weeks to months. The brain isn't simply built for stability, while the body is built for change. Different systems have different adaptation timescales. Points worth noting. While nothing rises to the level of a red flag, there are important caveats worth keeping in mind. Regarding menopause and cognitive symptoms, while the reassurance is valid, some women experiencing cognitive symptoms during menopause may have other underlying causes like depression, sleep disorders, or thyroid dysfunction that should also be evaluated. On the topic of inflammation and brain health, the episode suggests reducing systemic inflammation through external interventions slows brain aging. While lifestyle interventions like exercise and anti-inflammatory diets do show benefits, it's worth noting that antioxidant supplement trials have generally failed to show cognitive benefits. The relationship is more complex than simply reduce oxidative stress, improve brain health. The discussion of BDNF and exercise is mostly accurate, but most human evidence comes from peripheral blood measurements, which may not perfectly reflect what's happening in the brain itself. The bottom line. This is a high-quality, well-grounded conversation about brain health and dementia prevention. Dr. Mosconi appropriately uses hedged language for less certain claims and sticks close to the scientific evidence. The core messages about managing cardiovascular risk factors, staying physically active, and understanding that midlife cognitive symptoms often aren't dementia are all accurate and actionable. The main thing to keep in mind: the optimal approach to exercise intensity and brain health interventions is more individualized and complex than any simple formula suggests. But that shouldn't stop you from taking action. The evidence is clear that lifestyle factors matter significantly for brain health, and that's empowering news.